Hello and a warm welcome from my side as well. First of all, to our esteemed guest, Mrs. Maggie De Block, thank you for agreeing to have this interesting discussion with me. Opening the second day of Health World Congress. So thanks to all of you for joining the first session. We'll make it worthwhile because the first platform is a one-to-one natural discussion on a topic that I find most interesting and intrigues me the most in these congresses, which is to bring practices from other countries, also in Greece, and to speak about them and to have an opportunity to live through them and see them through the eyes of the people who made it happen. I must admit, Mrs. De Block, that I'm a big fan, you know it. Thank you for actually participating in our Congress, not only yesterday, but I'll give you guys an info. I mean, the Congress started on Sunday evening, that Mrs. De Block joined us in discussing with the Minister of Health of Greece, the Minister of Health of Cyprus, also what fruitful collaboration in pharma and biotech means. So today's discussion, I would like to focus on one of your great achievements. You're a doctor, you're focused on the patient. You've been serving as a Minister of Health and Social Affairs in Belgium in a time when, I'll take you back to 2015, if I'm not wrong, that it was a great, excellent, just after you were appointed. Wow, kudos for that. First things first, right? You dreamt and you made happen what became known as the Pact for the Future for Patients. And what I call Mrs. De Block, and also we had the discussion yesterday with Minister Georgiadis, she's the mother of the framework agreement. She made it happen. We talk about it in Greece, what a collaboration under an agreement between the minister and the industry could look like. Let's hear it from somebody that made it happen.
So since yesterday I have 3 children instead of 2, but okay, I'm the mother. I have the age for being that. So yes, in 2014, even before the elections, I had contacts with the industry and I had a dream and I wanted to do it, but I have to get elections and then afterwards being appointed to the post, of course. And we made the Pact for the Future for the patient. What does it mean? It was a cooperation between pharmaceutical and biotech industry and the government. And there were there was a financial framework, because that's important. The money has to come from where, but it was all about the patient, and we titled it Care to Change, Change to Care, because we wanted to get our patients faster treated, children, for example, faster to innovative medication, but also elderly patients. And the alliance was strategic, but it was fruitful, and so that is how we started to work, and then we got on. And of course you have financial struggles from your colleagues in the government, but before we launched the pact, then as minister we had 6 months of negotiations. And so we had really a big solidarity between industry and the government to achieve the pact.
Shall we get into this? Because I was intrigued by what you wrote, and I wrote your speech that you said in biotech and pharma policy, we are the recommendation. You said generally as Belgium, we take recommendations, but now we are the recommendation. So you changed the chip. And I must say that one of the reasons that I admired is that Belgium has been on top of pharmaceutical innovation for over 150 years. And I look at what you guys have achieved to become one of the 10 biotech valleys, and also that there is an ecosystem, a healthy ecosystem to which you started reaching out. Would you like to describe to us how is it working with the universities, with the research community? So you got a soil that was fertile for discussion. Who were your partners?
Well, the partners were certainly the pharma industry and the government, my colleagues, of course. But also, we have a long tradition of having good cooperation between our universities and scientific organizations and the industry. And then we have a lot of young people getting out of sight of the university and getting started their own company or going to work in a company and to have spin-offs of the working industry. But there is a link.
Like startups, you mean?
Yeah,
that there is also spin-offs and
spin-offs
startups.
and startups. So, so that is a long tradition, and it's growing and growing. Certainly in Leuven, but also Brussels, also Ghent. You have all industrial parks who are mostly next to the university.
Yeah, and this is what it was impressive. I realized that you had, in your speech you wrote about that you put together 8 universities, 19 research parks, 23 incubators, and best-in-class institutes like Flanders Institute for Biotechnology, right?
Yes.
So I guess that you took that opportunity, and that's the first lesson I'm learning from you, that you saw it as an opportunity to make Belgium at the heart of innovation and to brand it also outside of Belgium.
Yes, and then to start that, you have to talk first with people with boots on the ground who are doing the work or doing the research. So it took us a lot of preparation, a lot of visits. But
you visited one by one, you told me.
Most of them, yes. And also the pharmaceutical plants I visited to see what they're doing as research. And it's not only production, but it's also the research they are doing. And I asked them, each of them, confidentially, their pipeline for the future. And it was really a big pipeline. There was a research on Alzheimer, but also lots of diseases. Lots of going on with CAR-T, immunology was starting. I mean, I wanted to see the train coming, what is coming from innovation to the patient and how fast can we get it to the patient. So
that's amazing. And that's the second thing. I had so many, I'm learning so much from you, that you visited actually, you talked to the companies and you analyzed the potential of this innovation, how can we get it faster to patients. I find this remarkable because you did a lot of groundwork, right? May I ask you about a little bit the objectives, because I was intrigued. I think the title says it all. You said it's packed for the future for patients, and that speaks to us a lot. You said in your speech that what you wanted was faster access of innovation to patients. Would you like to talk to us about the situation before and after? What were the problems that you were trying to solve for the patients?
One of the problems was after EMA approval that it took too long to get the patient the medication. So we made fast procedures for children. We gained 2.5 years, normally it was 3 years, so in 6 months we had new cancer therapy going to the children. Also, of course, we did lots of research, because procedures in Belgium, they are very difficult to change, but we wanted to bring innovation faster to the patient. Patients don't understand there is a medication for me. Now with the internet, they are searching. There is something that can cure me or help me have a better quality of life, and I'm not getting it. And why am I not getting it? Because we didn't have approval yet. So the safety, of course, they made all the procedures to have enough safety for the patient, but you can have too much safety and it's costing your life because it's not getting fast enough to you. So, of course, we worked also, we invest a lot in R&D, research and development.
And the clinical trials.
And the clinical trials, that was one of our points. We wanted to be on the podium for the clinical trials. So there also we had a lot of discussion also with university because there's a deontological. And also we made a sort of register for clinical trials, a publication online that you can see which clinical trials have finished, which are not giving a result. There had to be, we called that the Sunshine Act, so
yes,
it had to be transparency is a very important, not only for us as ministry, but also for the patient. There has to be transparency at all levels.
I'm amazed by what you achieved. The minister is a very humble and very person down to earth. I'll speak about some of your achievements on what this brought. You shortened the reimbursement period by 50 days. So to all of us saying it's not possible, it's possible, actually it is possible. You got and you achieved and you enhanced pediatric fast track for all the companies that were investing. And one of the examples that struck me is that you also spoke about therapeutic modalities and you achieved product and biomarker reimbursement at the same time, something that it is in our minds of how we can speed it up in Greece. So amazing. And if I look at your clinical trials, Belgium is a leading force in clinical trials, second in the world. 170,000 patients that you achieved in order to actually look at approval times and facilitate patient recruitment. And that gave hope to many, many people. I'm amazed by this, Minister. I would like to ask you practically, though, I'm guessing the question that we all have in minds, because that's another thorn in the agreement process that we have in Greece, which is it needs also money. It needs funding.
Yes.
How did you go about that?
Well, we provided, of course, the necessary money for 4 years, but we also had reforms where we had price cuts up to 60%.
For generics, you mean?
For generics, but also for other older medications to fund new therapies. So that was also a difficult negotiation, I must say. You also have to keep talking because you have to implement the pact. So we had every 2 months contacts between my cabinet and the industry, and every 6 months, really, where are we standing now? Where do we want to be in 6 months? So the collaboration has to be continuously, and the trust also has to be continuously. That is very important. Of course, if you're talking about money, everyone has his own agenda. I know, I had mine also. And we installed also a cooperation between Belgium, Luxembourg, and Netherlands for very rare medications so that we could negotiate together. At some time we had Austria, Ireland, and England, but because of the Brexit, we lost England and Ireland.
You mobilized a lot of people,
yes,
though.
But that is something I regret about the Brexit. There is many more, but and we had made a year after this pact a medical device pact because of course it was a time where all innovation in all medical devices was coming to us also. So it was always difficult to find the money, but once you get started, it gets easier.
I'm impressed also by the results. So for all of us that are saying that it's not possible, you started negotiating, it took 8 months in total, but am I seeing right that you got how much money in 4 years? It was billion.
Yes, it was
1.14 billion.
Yeah.
Exactly.
That was what I got from the government. But if you start working, you have much more means to come.
Exactly.
Yeah, but also expenses, because I thought it was a train. I have to know every wagon what's coming to us. But at a certain moment, it was like a TGV, so it came much faster and it was bigger.
High speed, right?
High speed train. So it was necessary to have enough work done to follow the money we needed.
It's impressive, and that's what I'm also keeping from you. You invested in innovation. You took difficult decisions to make economies where there could be made economies in order to invest back to innovation, and that definitely paid off. May I ask you about what I also looked in the collaboration with other countries? You touched upon this, Minister. How did you go about in collaboration? I see that I read that you made joint clinical assessment, you optimized resources and efficiencies of HTA in order to get access.
Yes.
How did you do that? Because that's one of the discussions, as you saw yesterday, that we're having, that now with the EU HTA, we want this to be a vehicle to go faster access and not delay so that everybody agrees in the end. You reached some agreements. How did you do that?
Well, for that, you have to know everyone on the field and know who needs who. So and talk to them together and bring them together and convince them that by collaborating they will get farther and faster where they want to be. This is not always a success, but often it is. But not always, I must say. Sometimes there are some problems in one head or another. But if they look, if you get started and they see, it's working there, then some say, oh, I should have done it, but you can still do it, and so you get more and more people joining this idea of collaboration.
That is amazing, and I will go to the results. There is more than 35,000 jobs as a footprint of innovation in Belgium, and there is a strong development, and you attracted investment also from international companies for R&D centers, new R&D centers in Belgium as a result of Pact for the Future. Would you like to speak about the economic growth and what that meant for jobs, for attracting talents?
Yes, well, you first have the scientific jobs, the researchers and things like that. For that, we had a sort of tax cut, tax shelter, because they are expensive to recruit, and you have to pay them enough to come from another country to your country. And then there are the other jobs. All the fabrication, all the transportation, and so consultancies,
yes.
The whole of it. So we attracted a lot of people from other countries, and we made the procedure easier to come fast, because if you come from another country, social security, things like that, it can be a problem, it can delay your coming. And so we had a lot of young people and elderly people also, but scientific people wanting to come to Belgium because we were booming like that.
That's great, and that's actually the point of having the Valley, right? That, as you said, it was a mix of measures, so tax, policy, funding, but also incentives for people to invest, which is great. I think that what I'm interested also is, and you started touching upon this, would be to speak about how did you make the agreement? Because you mentioned that you had to also make hard calls. You needed also to convince, let's say, that we need to disinvest from older medication to invest in the new medication. I'm intrigued, how did you manage to get everybody to sign?
Well, it was not so difficult. If you say what you have in mind and how you want to get there together, it's not like you have an idea and you say you have to do it. No, we are going to do it together. So that's important.
But did you have in the follow-up, as you said, you had also provided a platform to follow up on numbers and KPIs. How did it exactly happen? Because sometimes what we're discussing here in Greece is that the framework agreement should not be something which is we just started, right? It should be something that is dynamic. We follow it up with numbers. And one of the asks that, and you heard it also yesterday and in our previous talks, one of our asks as industry is to have data and to look at KPIs together with the ministry in order to understand where is the investment in resources, what is the funding influx, but also what are the results. I would like your opinion because sometimes, of course, it's not easy, right? But what is not measured is not done. So how did you go about it in the ministry? How did you guys set up this follow-up? Because it was a long process to achieve results.
I must say that they all reported, and then we saw who is going good speed and who is having some trouble and how can we cure that. So, I mean, you have to have really, I had a cell of 3 people doing nothing but follow up of the pact.
Really?
Yes.
So it was 3 people in your ministerial team?
Yes, in my team, yes.
Okay, and what was the participation of the industry or of the academic community?
Well, there I also had with heads of universities meetings from now and then, but also there were daily contacts with people who were working in the labs and things like that. So
yeah, so that you had a lot of bottom-up information coming up.
We had to have all from bottom-up, of course. Yes.
Did the association play? I'm guessing the answer is yes, but just to share some learnings on that, we can also reflect on our role as pharmaceutical and biotech association.
Of course, everything was in transparency with, and we talked about it with pharma.be and the generics also. They were not so, but they did sign the pact at the end. They did sign the pact, so that was better. I said you are not concurrential.
Yes.
There has to be first innovation before you can make a generic medication if it's possible. So yes, we did a follow-up, very, very planned, and with but now with data. I mean, at that time it was a bit looking for, but it's easy.
That's very important. I would like to ask you about a topic that was yesterday mentioned a lot, and of course, it's you saw that in Greece we are very sensitive in a good sense about it. What did you find was the role of patient associations, and did you find them as let's say, partnering with you, advising you, because of course, I mean, you put the patient at the heart of the pact and faster access to innovation at the heart of the pact.
Well,
how did you go about it?
We had contacts with patients' associations, and we even made a group, separate group from representatives from associations for rare diseases for children, but also for other people, because their rare diseases. I was very active in installing the network in Europe. So for rare diseases and the rare diseases network, all our universities now are connected with the whole world, first Europe and then Europe with the whole world, to work together on the research on rare diseases.
That's impressive. So definitely the patient is consulting, the patient associations keep following up the work. I think that you gave me a lot of ideas on the collaboration part and who participates, and also I'm very much looking at what you did and setting up policies and course correcting what was not going, let's say, well. So, Minister, from your perspective, now when you also span it out in the medical devices, and I would like also to cover this topic, because here we have you realize that also we are discussing sometimes, and I'm looking at my colleagues from medical devices, healthcare, and we started spearheading the discussions on pharma environment as well in Greece, because as you realized, our discussions also with the ministry is about giving a more predictable, more sustainable environment for innovation. And that's our main goal. But also, I realized you also reached out to medical devices and expanded it. What was the thought behind this? How much time lag was there?
Well, when I came to the office, we saw that concerning medical devices, there was a whole new world getting open for our patients. We saw the stents coming, the new aortic valve, but so much more. And then we said, that's a sector almost like pharma, but concerning medical devices. Then you talk to engineers and other people. So we said, if we want to have innovation, we have to also pull them on our boat. Yes. So that's why that pact came after the other. Yes.
Okay, so it also became a spin-off pact. So that is interesting to hear. Minister, I'm reaching our, let's say, last part of our discussion. Wrapping up from what you realized the discussions was also into our parallel meeting with Minister Georgiadis. We are at the point that also, as you saw, we have a lot of healthcare changes as well in Greece, and we're operating in a very complex and challenging environment, both on the European level and global level. As we covered yesterday, a lot of trends, a lot of changes, and our raison d'etre is still access of patients, and this is what we want to safeguard with a more predictable, sustainable, and affordable environment. You gave me a lot of things to think about, a lot of things to take home, and thank you for all your tips and our discussions, and also with Minister Georgiadis. We'll definitely be having, we'll keep in the contact and the conversation. But I would like your opinion on the challenges that we are, because there is a will to do it. Yes. There is a political will, and Minister Georgiadis has expressed it, and also yesterday. There is a need to do it. This is the timing. As we were saying yesterday, we have a choice to make. Either we will make a more organized policy plan, or innovation will not arrive in Greece. On the other hand, the challenges that we often hear from the side of the ministry is how can we ensure funding, and how can we put an objective or a cap to all these practices like the paybacks that you heard, or cost containment, so that we know in a more sustainable and predictable way as companies where we operate. Looking at your example, what you achieved, I mean, putting Belgium at the center of Europe for innovation, putting second place in the clinical trials, putting more than the 5 months, let's say, speeding up processes. What would be the top advice you would give us to make it happen and surpass the challenges?
I think it can be an example to implement in your own situation, because it's different. You have the Isles. We are also little country, but we also did a reform of hospitals. I can give you a lot of tips to earn money there also.
Really?
But,
yes. You did in parallel.
For example, in Belgium.
Tell me about it.
When you had a child, you had to stay a week in the hospital, because giving birth is not always a disease. I mean, it's a sign that you're healthy. And I reduced it to 3 days, but not for women in social deprivation or with problems with baby or the mother, but for healthy women having a healthy baby, it was 3 days. Mm-hmm. And now we see my daughter, she had 2 corona babies, so she only stayed in hospital for 2 days because she wanted to get out of hospital. Yes. Before the virus was hitting her. So you see, now women are very glad with that sort of, and that saves a lot on the nurses, on, hospitalization, resources for hospitals. And hospitals earned also a lot of money by taking the trials with them. So that is also important for them. They can do the trials and they can get money in for hospitals. It's also, I don't know how it is here, but in Belgium it's a big problem. They are all building, renewing, but the money has to come from somewhere, yes.
Absolutely. No, I think that you're right. It's a little bit of looking at the healthcare ecosystem and looking at where you can make it.
And always be fixed on the patients. It's the patient who has to be helped. It's the patient who has the right to have the best care and also access to innovation.
Thank you so much, Minister. I'm keeping a lot of tips, a lot of advice.
I stay at your disposal because I'm out of politics. I have a lot of time now.
Thank you so much. You gave us a lot already. Thank you so much for this talk.